Okay, welcome to ASCP's podcast, Our Experience. My name's Chad Wers. I'm the Chief Executive at ASCP, and alongside me or across a few states is my partner, Tom Hansel. Um, Today we're going to talk about HomeMeds, and we have two very special guests. We have Amy Amond from Giant Eagle, and we have Madeline Barnes from the Jewish Community Center in Pittsburgh. Welcome to the show, ladies.
Thank you.
Hi, thank you for having us.
Absolutely. Why don't we just start with some introductions? Amy, why don't you tell us a little bit about yourself and your practice?
Perfect. Well, thanks. Again, thanks for having us on here. I'm excited to have some good conversation today. I am with Giant Eagle Pharmacy. I am a pharmacist. I've been with them for over 20 years. Giant Eagle, for those that don't know, is a grocery store pharmacy chain. We're in about 5 states, but Pennsylvania and Ohio carries the majority of our 217 pharmacies. I actually work on the managed care team where I oversee all of our clinical programs, which is what brings me here today.
Awesome. Madeline, how about you?
So I work in Agewell at the JCC of Greater Pittsburgh. So Agewell is the senior center within the Jewish Community Center. There's JCCs across the country and Canada, I believe. Some of them have senior centers, some of them do not. So we are Agewell at the JCC. So we provide services for older adults age 60 plus in the Greater Pittsburgh area. We have a physical senior center in the Squirrel Hill area of Pittsburgh and also in the South Hills. Our center is designed to foster social networking and offer health and wellness programs designed to help older adults 60 plus stay active. That's physically, mentally, and socially. So we offer like a lunch program. We have different clubs and events that take place. We offer programs like HomeMeds. So we're kind of the social recreational side of what you might think of as like a typical senior center.
Awesome. So we've had a couple podcasts talking with the people at the Partners Care Foundation in their HomeMeds program. Give us a sense of how your programs link to that program and how you utilize that program.
I can speak to that. So, and this is kind of how we're connected with Giant Eagle Pharmacy. So, there's different funding sources for our program as a nationally accredited senior center. So, but a majority of our funding comes from our local area agency on aging. So we get some funding for some evidence-based programming. So one that we've been doing, I've been with the center for about 6 years. One that they've been doing, and since before I got there, is the HomeMeds program. So we offer the program at our center. The JCC holds the contract with the county. So I offer the center at our program, but I also am in charge of training other senior center sites to administer the program. So we have seniors who come for programming, sign up to get their medications reviewed, and then we actually work with Giant Eagle Pharmacy as the consulting pharmacy. So we'll do a screen with someone that comes into the center, we'll put it in a system, and then we work with Giant Eagle to actually review those medications, and then they reach out to the individuals.
Awesome. And Amy, anything to add from your perspective at Giant Eagle?
No, clearly we're the provider of the service. We work closely with Maddie and I'd say her whole team. She has an army of volunteers that are actually instrumental because they're the ones that do, the original outreach and then makes my team's job a lot easier. They go in and we get to review the meds and really have that contact with the patient so that they, get the care that they need if it's warranted. So I think that's really kind of, our action is being the provider.
Yeah, we've talked a lot with Partners in Care, and it's kind of funny. They've been around for a long time. And you think about the pressures on the healthcare system today, and they're about this aging population. They're about the number of individuals, the polypharmacy issues that they have. And I give them a lot of credit because they were way ahead of this. And it's really interesting to see that some of the things that you're doing today are still way ahead of even some of the thought processes that we probably need to be employing to take care of an older adult population in their home. The collaboration between areas on aging and groups like yours with the pharmacy and creating that dynamic that's wrapping their hands around the patient is, I think, what the future looks like. But you guys are doing it now, and I think that's really cool.
For sure. Chad, collaborative care is probably one of the biggest, I'd say issues that, any healthcare provider, your doctor, your pharmacy, anybody sees because, your patients they're going to, especially our older population, they're going to many doctors. A lot of times, unfortunately, with our Medicare patients, donut holes, cost of medications, they're starting to shop even pharmacies. So we're seeing them going multiple places. So having a program like this really gives that one set of eyes that can kind of really review and look over things and try to pull those pieces together and get, everybody on the same page. So yeah, we're very thankful that there's, organizations that can bring that to the elderly population for sure.
Yeah, no doubt. Amy, as a pharmacist, one of the most frustrating things, and I'm sure you can relate, is really when it comes down to medication adherence. Long-term care, we don't really have that issue as much. Typically, we've got nurses, we got med techs, we got people that are assuring that they're getting their medications. And, but the less acute that a patient gets, the more independent they get, the less the adherence that they end up having. And, what's the purpose? I've always said, what's the purpose of being a pharmacist? It's not to dispense medications. It's to help my patients get healthier. And the only way we could do that is through medication adherence. So coming from a clinical pharmacist point of view, when you don't have the oversight that we have inside the LTC, skilled or AL, but now they're independent. And like you said, potentially polypharmacy, how has HomeMeds really helped with medication adherence?
Wow. Well, I'll probably go back to one of the things that I said a little bit earlier is being able to kind of visualize and see everything, all at once. So, coming from, we're a local, hometown kind of pharmacy, perhaps we have the patient at our pharmacy. So I only get to see, a few of the medications, or, my team gets to look. And then now we're in a program where we see there were 5 other medications added and we're like, oh my gosh, so having a program like that really kind of brings it all together. So as a pharmacist, you're looking, now at a continuum. You get to see, the patient in their entirety. From the patient side, having a program like HomeMeds really allows the time. I'd have to go with education as probably one of the biggest things. From a patient standpoint, sometimes the feedback I get the most from, my pharmacists that are talking to these patients is, thank you. I didn't really know all of this, or I didn't know, I shouldn't take these things, and really explaining how necessary it is for them to be on, medications, and the why behind it, instead of just do it, really seems to, take it that much further for them and give them that understanding where they're able to stay more adherent, and they're doing it because they know why they should be, not just they're told to do it.
Maddie, what about for you?
I agree too. So of course, at the senior centers, our role is, most of the people administering the screens are not health professionals. So we're simply kind of just asking the questions, taking down the medications. Of course, I still get asked a bunch of questions as I'm doing these screens about, medications. So, and I note those questions down. I'm like, I'm not a pharmacist, but you will have a pharmacist review this. Let me put a note next to that. So, and then the pharmacist review the medications and then speak to those people who participated on the phone. And I think that's the most valuable thing is, when an older adult or anyone goes into a doctor's appointment, those appointments are so rushed and so fast, and doctors are great, but they're not always the experts on drugs or might not have the updated list of what people are taking. So for our population, having the one-on-one time with a pharmacist whose expertise is medications, to sit down with them, review everything they're taking, answer any questions they have. It's very educational, very helpful. And to, we've talked about like people going to multiple pharmacies. I think a lot of things that I see when I'm doing the screens, taking down medications or trying to get someone to do the program, they might see, oh, I only take 1 or 2 medications. I don't need this. And I'll say, oh, like what about over the counter things or supplements? And then they'll be like, oh, sure. And then, so I think a lot of people are maybe not telling their pharmacy or telling their doctor all the over the counter things that they're taking, which can definitely interfere with their prescription medications or might be duplicate therapies. So that's another opportunity too for that education piece for the pharmacist to say like, hey, you shouldn't take these 2 things together, or I see why you taking this sort of thing. So I think the education component is the biggest piece. And when I do hear back from a handful of our people who have done this to say like, oh, I got a call from the pharmacist. They were so nice. They talked to me for 30 minutes or something like that. So I think it's very valuable.
Can you talk a little bit about, we talk about underserved populations, people that don't have access, but it sounds like it's possible that you really see kind of a broad swath of people that you might engage in embedded into this process. Is that true, or does it tend to be individuals maybe on the lower socioeconomic scale?
Yeah, it's really a wide range. So the only qualification to be a member of our Center of Age Wealth, the JCC, is that, and like a lot of centers in our area that are contracted with the Area Agency on Aging, is that you're 6 year older and a resident of the county. So we see people come in like as soon as they turn 60 to sign up for our program because they know they can get a meal there. So you might have people like that, but then you also have people that are coming to work out, do their classes, do their social things, and like lunch might not be the main draw. So it's definitely a wider range of people that we see in terms of socioeconomic status, but we do see a lot of people who may be on the lower end who come to our center to get their basic needs, like nutrition and a place to get out of the cold or get out of the heat, depending on the time of year. So it's a diverse population that we see. And this program is open to anyone as if they're a member of our center. And it's free to be a member of our center as well.
Amy, how do you perceive it from your side?
So that's really interesting that you say that, because you can kind of pick up pretty quickly when you have a conversation with someone, where their health literacy, if we can use that word, where that kind of lies. And we see the full range. We have clearly people that are on it. They understand, they might have a quick question, but you can tell they are, in charge of their own health. And all the way down the scale to the people that, are having to choose which medication they take, maybe because of, the cost. So they'll doing, well, I'm only taking this every other day and the other one every other day so that I don't have to pay so much. And then you really have to, there's two different conversations you're having there. Because you want to make sure that, both ends of the spectrum, have the knowledge and get their questions answered. But obviously you want to, the patient that's trying to stretch their meds out, it's a different conversation to have in a different way to help them with resources. A lot of times your help isn't even in explaining the medication, but, finding them coupons or programs or something to, make sure that they can take it the way that they're supposed to. And it's not that they don't maybe want to take it that way, it's that they really just can't, and they're looking for, ways to kind of cut. So we see it, and it's just kind of, generally you can kind of tell pretty quick, and it's really diving in and helping, that particular patient. Each one is different.
Yeah, I think it's important. I mean, we do a lot of work trying to, obviously, we're a pharmacy society. We're trying to get more opportunities for pharmacists. We're trying to explain more about what pharmacists do for people, particularly in that older age group. And we hear a lot about programs and quality measures that are designed to look at socioeconomic factors, especially as they relate to health. But I'm always struck by the fact that, it really doesn't matter. An older person has very complex medications. They have specialists that they see, as Madeline pointed out. They're getting things over the counter, and the people in those lower socioeconomic environments aren't the only ones that need a pharmacist to help educate them. And I think it's really important to tease that out, because there are places where we talk about pharmacy services where we kind of want people to have sort of a keep up with the Joneses, or hey, why do they get that service but we don't get that service mentality. And nursing homes is one of those areas we kind of want to create in the son or daughter. Hey, why does my mom and dad get a consultant pharmacist in a nursing home but I can't have one at home? So how do I get that kind of a service? And that's anybody. That's not just individuals based on their economics. So it's good to hear. It's an interesting angle, because I would anticipate you are seeing people broader than just maybe those that are on the lower socioeconomic scale. For sure. It's interesting.
Yeah, I mean, a geriatric patient's a geriatric patient, and even if they do have family close by, the chance of this family being healthcare professionals is very minimal. But Now we're sitting there with 50 million people across the US that are 65 or older. Many of those are 85 and older. And that number, as we always talk about, is going to grow by 40% over the next couple of years. And it's almost overwhelming. For me, I live 12 hours away from my parents, and I could talk to them and try to explain things even as a pharmacist, but that didn't take place as someone looking down their chart and seeing all the other medications and kind of reviewing that and spending that quality time. So, it's I think it should in somehow, some way be almost a requirement for the safety of our community. Back 25 years ago, we had the hometown pharmacist, and people weren't as mobile. They counted on their pharmacist. They didn't have polypharmacy, and now with mail order and all this other stuff going on. But I bet you both of you have some pretty interesting success stories, or maybe something that you might be able to tell about. When we talked to June a few episodes back, she told some very good stories, and it just emphasized the care of what HomeMeds is and the difference it's making. But you want to volunteer any good stories?
Sure, I can share one that I kind of remember from when I first started doing the program. There was a woman who, because part of my job too is to try to get people to participate in these programs. Sometimes it's really easy, and sometimes we offer incentives. So sometimes people, might be kind of hesitant because they're sharing personal health information, or oh, my doctor knows I don't need to. So, but when we do get people to participate, we kind of realize how valuable it is. So this one woman, like sitting at a table recruiting people to sign up for this program, and she did it with me. I mean, I just took down the information, sent it to the pharmacist. And when they called her, they caught a big red flag. She had, at the time, she had a bad cold and she was prescribed something for that. But I think she was still having symptoms like a sore throat or something like that. So she went and got something over the counter as well. So she hadn't been taking it for that long. Thankfully, by the time the pharmacist looked at it, when they looked at her thing, they reached out right away and they said, hey, the prescription medication you're taking and this over-the-counter stuff is like the same active ingredients, and if you continue to take these, like, you could overdose. And she's this older woman, so they stopped that right away. So I mean, she had no idea. She didn't even consider that would be, she just was looking for something to ease her symptoms. So thankfully the pharmacist caught that issue right away, and the woman stopped taking the over-the-counter thing. So that's just an example of you get something over the counter, you think it's harmless, and the whole thing's having like similar ingredients, and the possible for overdose is a real thing. So that kind of to me stands out, as especially from when I first started, like as a store, I'm like, okay, more people need to be doing this program.
Yeah. And that's always, makes you feel good when you're participating in a program and in someone's safety, was taken care of there. My team shared with me, it wasn't me personally that got to talk to this patient, but they were pretty happy with the outcome. One of our pharmacists reached out, and initially the lady was unable to complete, the medication review because she was being the caretaker to her husband. Her husband had fallen ill and she didn't have the time. And the pharmacist just made a comment at that time, well, as a caregiver, you have to make sure that you're well, or you're not going to be able to take care of your husband. And the phone call ended, and less than 48 hours later, the lady actually called back and asked to talk to that pharmacist. And it really resonated with her, the fact that she was the caregiver. And if she didn't, have everything checked out for herself, that perhaps there was, could be something, and she wouldn't be able to do her job for her husband. So they, completed the medication review, and actually there were a couple side effects that they were able to remedy for her by, managing the timing of her meds. And they got her 2 vaccinations that she was, needed, looking out for shingles, stressful situation being a caregiver, look for that. And I think the other one was a pneumonia vaccine. She was qualified for that. So keeping her health, they kind of impressed upon her the importance of, as a caregiver, taking care of yourself is just as important so that you can give that care that someone else needed. And I thought that was really great too, because sometimes people forget about themselves when they're in a situation, where maybe they are the caretaker. And had we just talked about, even the people in the nursing homes, their families, that are there and taking care of them and coming to visit, and everybody's worried about, perhaps the elderly people. Sometimes you forget about, the ones that are, the caretakers in the situation. So I thought that was a nice, someone came back and actually, saw the benefit of the program.
Yeah, I think caregiver burden is a huge, huge issue. You're even starting to see some payment mechanisms for the education of the
Mhm.
caregiver that's taking care of somebody with particular issues. I think dementia is one of those
Sure.
issues where you've got that opportunity. So you're seeing a little bit of a move that direction. I think it has to come a lot further
Sure.
because we do, I mean, caregiver burden is one of the most significant pieces of this whole healthcare evolution that we're going through with this patient population that's getting older. One of the things that I wanted to ask, and you may not have an answer to this or not, but obviously this program flows through the Jewish Community Center and it flows into Giant Eagle. Are there opportunities? Obviously, you see a lot, Amy, on your side,
Mhm.
and you probably have your team probably sees a lot of people that, man, they could use this program, but
Mhm.
they're not a member of the Jewish Community Center. Maybe it doesn't make sense for them to be a member for whatever reason. Are there outlets for those patients, or do you have other programs that you might be able to work with or send them to that could get them access to this? Or is it as simple as, hey, the Jewish Community Center has this program and you should go talk to them?
So some of it is just as simple as what you said. Unfortunately, there really aren't a lot of programs like this. There are some insurances, like the pharmacy benefit managers, the PBMs, that will offer what we call a CMR, like a complete medication review, once a year, that a pharmacist does get reimbursed, for going over those. But it's a little bit different. I mean, the idea is the same. You're still going over the medications. This program with HomeMeds is a little more, I don't know. You want a little more conversational and more intimate than just, when you call and, oh, your insurance requires you have this once a year, and you kind of go down the med list. And some of those get pretty, involved, and you feel helpful. But this HomeMeds program is I don't know, it just seems a little more, maybe because of the um the community center behind them, that they kind of have that already, that feeling of just kind of be a little bit closer. But unfortunately, I wish there were more, Chad. I wish we could say, hey, you need this, here's these programs, and check them off the list and add them to them or whatever. But unfortunately, it's relatively limited.
Yeah, and again, I think that makes sense, and I think that's I don't want to say it's important, like it's important that they only have this outlet, but it's important so that other people see it and other people ask the question, well, boy, I'd really like to have that. How do I find my way to something like that? So it just puts more emphasis on what we do to keep pushing for opportunities, keep pushing for places where people can access good, all inclusive care. Because what they're getting through the center is not just the home meds piece. I mean, that's a part of it, but they're getting this wraparound service.
For
And we've
sure.
talked on other podcasts about there are people that are sort of self-creating these environments. There's a group I talked to that called themselves the Arlington Neighborhood Village, and basically it was a collection of just older adults that came together as a group and said, "Hey, let's help each other find transportation services. Let's help each other find other services that we need as we get older." So there's definitely demand, and it's about finding better structures to get people linked to so they don't feel like I've got to figure this out on my own. I don't really know how to do it. So I think the community center model or a central model that then links in the pharmacy is a good model. It's just, pushing for it.
Yeah, and I would encourage folks. So we hold the contract, but we offer it to senior centers throughout the county. So there's a lot of senior centers in Allegheny County. So when we get the contract every year, we reach out to providers and say, "Hey, do you want to participate?" And there is incentives for their center for participating. Reasons a center might not participate is just might be to a staffing issue. They don't have enough staff to administer this program. But I would encourage anyone who's depending where you are, check out your local senior center. Some places it's 50 up, some's 55 or 60 up, and see what kind of programs they offer. I know when you think of senior center, and we try to call it like an older adult center, but I'm using the term senior center because that's what folks are most familiar with. We healthy active living centers or something like that, to check out what programs your local center offers, because you might have an idea in your mind like, oh, I don't need to go to a senior center. That's not for me. But you never know what kind of programs they offer. So it's definitely, because I know a handful of centers, and a handful of area agencies on aging across the country do offer the HomeMeds program. So it's definitely worth checking out your local center to see all that they have to offer outside of just like the typical bingo and that sort of thing.
Right.
For sure.
Well, it's really healthcare collaboration at its best, and for the community that needs it the most, which is that home-based community. Amy, as a pharmacist, I really commend Giant Eagle for taking a clinical approach and getting more involved. And when I graduated from pharmacy school, it was like, "Well, do you want to work in retail or hospital?" And I found long-term care and fell in love with it. And you guys are really taking that retail dispensing, but you're turning it into what it should be, which is more of a clinical approach. So I would imagine pharmacists are very excited to have an opportunity to use their clinical skills, but work for the company like Giant Eagle.
Oh, for sure. For sure. And there's always going to be a need for that, that retail pharmacist that is right there. I mean, long time ago, I heard a stat that, a person gets 7 minutes with their physician. I think that even Maddie alluded to that earlier with how, often how pressured, the doctors are. And so pharmacists really are your most accessible healthcare professional. They come straight from there. They maybe don't, heard everything, but it was so quick. They need that, that person to kind of walk them through it again. And I'm proud to be part of that team that can, take them to that next step and take retail to a more of a clinical side and really help our seniors for sure.
I want to say too, in terms of accessibility, Giant Eagle too partners with us not just for this program, but we do like huge vaccine clinics. So they're bringing those kind of services to our center, so seniors don't have to go. I mean, there's a lot of Giant Eagle pharmacies around that might be convenient for them, but a lot of people are coming to the center already to have their lunch, to exercise, to do their program. So we offer multiple vaccines clinics with Giant Eagle, the HomeMeds program. These are places these people are already coming for activities. So we love being able to bring these kind of clinical services to them to make it that much more convenient.
I think that's another piece of this that's such a big deal, is we've got to meet people where they are. I think we learned that to some degree in the COVID emergency, that yes, there were a lot of people that could make it to their pharmacy and get their vaccine, but then there were a lot of people that could not. And how do we take care of or find those individuals that could not, including going into their home? So I think having an ability to meet them, having a partner that's willing to meet them wherever they congregate, I think is important. So it's a really big deal that you have those vaccine clinics at the clinic, as well as the opportunity to get them at the pharmacy. People need options to be able to get what they need. Tom, any closing thoughts from you?
I just want to point out that once again, excellence is coming from the city of Pittsburgh, and I think it needs to be said. So, clearly, thank you, ladies, for showing how wonderful,
I have nothing
how brilliant and wise.
You're exactly right. I mean, this is a Pittsburgh-based opportunity, and they are leading. I'm not going to take away from that.
Leading the world once again.
That's right, leading the world. Ladies, any last comments from your perspectives?
No, I appreciate you highlighting some of these wonderful things that are happening. I wish everybody could see what good the JCC does. The fantastic programs and stuff. It's a gem to have, and I mean, it is in Pittsburgh too, Chad. So that helps. But no, we appreciate you, giving us a little shout out today.
There have to be some Cincinnati-based programs that are just
I'm sure.
find them.
They don't care about their seniors in Cincinnati.
So the other thing I would say is that there's opportunities here to make sure that we are talking about what you're doing, not only informally like the podcast and explaining the services, but also formally in terms of what data can we capture from these opportunities that we can then parlay into a conversation at the government level, whether that's state or federal, about the need for these services, because that's really the next step, is to make part of your Medicare benefit should have something to do with having access to a pharmacist that's looking at their entire profile of medications, and trying to make sure that they're successful in a way that allows that person to age the way they'd like to age from a quality standpoint. I would have, we talk about this all the time. No one aspires to live in a nursing home. No one's getting ready for that day when they can go. But they do aspire to age in place and age at home. And that requires a lot of people supporting them, both from the community perspective, the community center perspective, or a clinic perspective, as well as from a pharmacy perspective. So we really appreciate what you guys are doing in this program. And again, it's a pioneer and it's leading us. And we'll pull healthcare up with these kinds of programs and make opportunities for pharmacists. So thank you for being on the show.
Thank you.
Yeah, thank you for having us.
I said I got a website to share about HomeMeds.
There you go. I was going to do it, but go ahead, Tom.
Oh, okay. Fantastic. We can do it together. It's www.picf.org/HomeMeds.
And that's for pharmacists to get involved. I would also assume areas on aging, as Madeline talked about, to be able to find their way to get involved with these programs. So again, thanks very much for being on. Appreciate it. All right. We'll see everybody next time on the next episode of Our Experience.